presentation is actually about acknowledge the hard work done by Sean Drake. So maybe 2-3 years ago, she presented a similar study into knowledge within the US. So the study is actually using her questionnaire. Okay, so firstly, my name is Jason Black. I'm a physiotherapist at Scoliosis SOS. I've got nothing else to disclose. So, firstly, there's been 2 studies previously done, both in Poland and in the US, that have shown that knowledge among idiopathic scoliosis, whether that be treatment, diagnosis, or just how you should manage the condition, is very poor in response to the social guidelines which we spoke about yesterday. Previous studies have also shown, and presented by Giuseppe Bettany last year, that the information that's given at the first point of contact to patients that are just diagnosed, it's haphazard. Some good information, some not so great. This is really important when we're looking at the UK now. There's a big push towards self-referral system within physiotherapy. So physios are going to be the first people to see patients that come with back pain or that slight asymmetry of posture. And as it is, we don't know what the physios in the UK will respond. So the aims were to find out, these physiotherapy students that are leaving the university, what do they actually know about idiopathic scoliosis? So a previously designed study with a 10-question survey was designed by Sean Drake, and it was implemented in the USA. So we took that questionnaire at her permission and we transcribed that onto an online survey platform. It consisted of 7 questions based on the social guidelines again, looking at definition, cause, development, prevalence, diagnosis, bracing, and treatment. And there was also 3 open-ended questions at the end about physical activity and the recognition of what schools of treatment are actually out there. It was conducted in autumn 2015. To do this, I approached all physiotherapy-based universities within the UK. I sent an email to every single one, contacted everyone, invited them to participate. And they were asked to send out the questionnaire to their final and penultimate year physiotherapy students. So because they were distributing the questionnaire, I'm unsure how many actually received it in the end. So when we looked for ethical approval, we were told no central ethical approval was required, as long as we got the approval from the clinical lead from each course. So by making them distribute the questionnaire, we got around that quite easily. So the results were, there was 206 respondents that met our inclusion criteria. 165 took the time to fill out the 5-minute questionnaire and finish the whole thing. And it was spread out actually quite well. It was across 12 different institutions, taking in Scotland, England, UK, Northern Ireland, and Wales. So the results of this, so when we looked at the definition of scoliosis, I think the most shocking was that 88% of the people that replied thought it was a 2-dimensional condition. Bear in mind, this is a multiple choice question. They were given the option of a 3-dimensional condition, or is it a lateral curve, and they went for lateral curve in most cases. The causes of idiopathic scoliosis, 48% thought there was a cause of an unknown cause condition. And when it developed, they did actually get this right in adolescence. How prevalent is it among patients with scoliosis? How prevalent is the idiopathic form? So 76% weren't quite sure of this. And quite poorly, if we're going to be the first that meet the condition, only 12% were able to tell you how you should diagnose it and how you should tell this is scoliosis. Bracing recommended they did quite well, so 54% were able to say when bracing roughly should be attributed. But unfortunately, as we were talking to physiotherapists, they actually didn't know what physiotherapeutic exercise should include when you're treating scoliosis. So, in conclusion, when you took it all together, only 7% of the respondents were able to answer more than 50% correctly. The UK students performed worse in all aspects to their US counterparts, except when asked what should the treatment include, but again, that's 6% versus 3%. And finally, just a point of interest, one of the open-ended questions at the end asked what method of conservative treatment are you most familiar with, and these are the only respondents we had. So side shift was the most recognised. It's conventionally used a little bit more in the UK, but as you can see, Schroth fits not very high. Most of them don't really know much about scoliosis treatment. Okay. Thank you.
This is for Jason. Excellent use of Sean's previous, application of that study. I really appreciate that. Are you having any plans to share the results of that with the faculty in the UK, and what might you expect to change?
So actually I will be presenting this again at the World Conference of Physiotherapy, which is actually hosted in the UK this year. So I'll be presenting this again, and I hadn't originally thought about sending out all the results and spreading it, but I've spoken to Theo about publications and how to bring this forward in the future, and there seems to be a massive interest to actually not just present to 200 people here, but tell people that we need to push on with the guidelines. So I probably will be going forward with it and try to get it into, there's definitely the magazine that goes to all physios in the UK, and try to get that published through there.
Countries that have done a similar study and what the results were like?
So actually, we're sitting beside one of the gentlemen that did it in Poland, so he did a similar one, different questionnaire, and I know that the US did the same questionnaire a couple of years ago, and to be honest, their results were very, very comparable to ours. They performed slightly better in all aspects except for what treatment should be used, but it hasn't been published as far as I'm aware to this point, so it's just been in the presentation here, so we need to move forward with publishing knowledge as well.